We also know that, yes, it is a break, well, not a break for parents. Your kids are home, and I remember the days very well, and all the chaos returns and all the excitement over the holidays. But the kids will be going back to school, and all of us agree we have a strong public interest in keeping our kids in school. We went through the social experiment of keeping them isolated, and what teachers had to go through and parents and the children was extraordinary. And the results are now showing that the learning did not continue the way it should have, and we had hoped it would, as well as the emotional effect and the toll it's been taking that is manifesting itself, as we see in our young children all the way up to our teenagers now. So parents were encouraging to get them vaccinated, your kids vaccinated during the break, and school districts encouraging you to do your best efforts to help limit the transmission. And what we're talking about is an outreach which has been very intense to all 731 school districts through the boards of education, cooperative education, BOCES as it's known. And we've been ordering tests. We've anticipated this day. We want to make sure that we have at least 3 to 3.5 million tests out to our schools, dedicated exclusively for children in schools, and we're working to get those out there. In fact, we are deploying over 2 million test kits to the City of New York schools so they can be in hand for the school districts to be able to deploy them the way they choose, whether it's sending them home with children after the first day, whether they can institute testing in schools. We will leave that up to them, but it is our responsibility to help them with their amassing the necessary number they require, and that is why we're having 2 million to New York City by Friday, and also to have 3.3 million available to the rest of the state. So Commissioner Bray will give more details on that, but that is something that we're deploying our state team to help us out with, and I'll be talking about that in a couple minutes. But we want to make sure that these schools stay open. As Dr. Bassett said, most cases are not being transmitted in schools. Children are wearing their masks. We want more vaccinated. We want them boosted at some point, as soon as possible. But we understand that it is not a good option to say children are going to be returning home again. Subject to possible changes in the future, but right now, that is absolutely where our position is. It's unwavering on this date with respect to looking at a date of January 31 to get the children back to school. We're doing a call with all 500 superintendents. Tomorrow I'll be having conversations with them directly myself, in addition to the ongoing conversations that are being conducted by our team. So at this point, I'd like to turn it over to Commissioner Bray to give an update on our testing and other operations, and she can give you the real nitty-gritty details of what she has her hands in. So, Commissioner Bray.
Thank you, Governor. Thank you. As the Governor said, it's really an all-hands-on-deck operation to keep kids in school, and you know, it's our responsibility to supply as many of our districts as we possibly can so that they can supply as many kids as they possibly can with kits. So I just want to go reiterate some of the numbers. It's about 6 million tests, 3 million kits that will go out this week. Of that, 2 million tests going directly to New York City. There's 731 endpoints. Those are our districts. We'll be supplying them through 60 different hubs throughout the state. Those will include the BOCES, some direct-to-school districts, and some county hubs. Planes with these kits begin arriving tomorrow. They will be landing in the state every day this week. We've got over 100 trucks on the roads from warehouse to warehouse to our hubs. And I want to thank our state partners, DOT, Corrections, the National Guard, Thruway, Canals, the Port Authority, and of course our team at Homeland Security and Emergency Services that are making this operation this week possible. We'll be prioritizing delivery based on case rate by district so that we make sure that the kits get to the districts that are seeing the highest level of transmission as early as possible in the week. I also want to remind everyone that that's not the only way that we're expanding access to testing. Pharmacies and urgent cares across the state continue to offer testing, including walk-in testing. Last week, we delivered over 1 million over-the-counter tests to county local health departments outside of New York City. Last Wednesday and Thursday, we delivered 600,000 over-the-counter tests directly to New York City. We watched as those tests went out to community members and to relieve pressure in the lines in New York City. Any county that wants additional testing sites is able to request staff and supplies from the state, and we've been supplying those as counties step up their work. There are 13 new state sites opening this Wednesday. Those will not be the last of the state sites that open. Those will be the sort of first wave this week. The MTA opened 2 walk-in testing sites at Times Square and Grand Central last week. We expect 5 more transit hub testing sites to come online this week. And our over-the-counter orders, our over-the-counter deliveries this week will not be our last. We're going to be doing rolling deliveries every week, every other week, to all of our counties, both to our school districts, but also to communities, to make sure that folks are prepared.